Hi, Dr. Mark Agresti. I want to do a follow-up video by popular demand because people have been watching my video on how to detox from opiates using Subutex, Suboxone, buprenorphine with naloxone. It's the trade name and the chemical name. Now, what else can you do? You can use the Subutex, the buprenorphine, to help you come down. We've established after a period of opiate use, pretty much more than 5 days, you're dependent. You need to stop the opiates, you go into withdrawal. Before you can start the buprenorphine, which I explained in other videos, you have to clear the opiate from your system, which takes about 24 hours. At that point, you'll start noting hypersalivation, increased salivation, sweating, hot and cold flashes, maybe goose flesh. Nothing too serious. It's the beginning of opiate withdrawal. Key here, stay hydrated and try and eat like chicken soup or get some kind of nutrition in your body. To prevent further opiate withdrawal symptoms, i.e. cramping, diarrhea, vomiting, confusion, could lead to psychosis, kicking of your legs, that's why they call it kicking. What you'd have to do is start the buprenorphine, but that doesn't always work. So there's other things you can do. What are the other drugs you could use? There's a drug called clonidine. Clonidine blocks the body's peripheral receptors to opiate withdrawal, means it will settle things down. 0.1 to 0.3 milligrams every 4 hours. It will lower the blood pressure, but it will also block what's called the alpha-2 adrenergic site, which is your body freaking out, basically. It'll block it. So a lot of the symptomatology, anxiety, goose flesh, hot and cold, malaise, it will block a significant portion of that. I would say it blocks 60% of opiate withdrawal. So if you use that in conjunction, the opiate withdrawal will be dramatically less if you use it in conjunction with buprenorphine. There's another drug similar to it, lofexidine, Lysimra, which is virtually an identical thing. That's given 0.18 milligrams, 3 tabs like that, every, say, 5 to 6 hours. They're virtually identical. And clonidine is not branded, it's dramatically cheaper, so just go with that. Now, it takes about 5 days to clear yourself from an opiate withdrawal. You don't want to use the buprenorphine too long because you could become habituated to that. So what else can you do? Well, when you're in this opiate withdrawal, you are unable to sleep and you're very anxious and you're nauseous. Mirtazapine, a drug called Remeron, can be used at night, 15 to 30 milligrams. It'll help you sleep, it'll get you through the night, it will block the nausea, block some of the anxiety, and help you sleep. That's all it's good for. Clonidine and lofexidine are more for opiate withdrawal symptoms. Shivers, hot and cold flesh, goose bumps on your skin, hypersalivation. That means a lot of saliva produced, feelings of malaise. So the clonidine blocks pure opiate withdrawals. Remeron will block just the sleep, a little anxiety, and the nausea. Something else, promethazine, can be used to block the anxiety. It's called Phenergan, 25 milligrams to 50 milligrams every 4 hours. You can use combinations of these drugs. There's no interaction with these drugs. This is critical because the Phenergan can also offer anti-anxiety effects. I wind up using clonidine I wind up giving people something every hour. Clonidine, then a Phenergan, then a mirtazapine. Now, because there's serious muscle tension and kickings, muscle spasms, it's a key component of opiate withdrawal. This lasts 5 days. Methocarbamol, which goes by the brand name Robaxin, or Xanaflex, which goes by tizanidine. Robaxin is usually 750 milligrams 3 times a day. Tizanidine is usually 0.2 milligrams every 6 hours. For the patients out there, don't use Soma, don't use Valium, don't use cyclobenzaprine. Soma's trouble. It interacts with the other drugs. It may cause confusion. It's addicting. I don't like it. Do not use that drug. It leads to a host of other drug interactions, over-sedation, confusion. It causes euphoria, and it's not well tolerated in most people. Cyclobenzaprine will make people too drowsy. It's a dirty drug. I don't like it. Valium results in confusion, sedation. I don't like it. So don't use those. If you want to treat the muscle spasms, muscle tension, use methocarbamol, Robaxin, or tizanidine, Xanaflex. Don't use Soma, don't use Valium, don't use Flexibly, which is cyclobenzapine. Now, if you have anxiety, listen, this is the last resort, but I give people 1 to 2 milligrams of Ativan or lorazepam every 4 hours. I try not to use it, and if you're in an opiate detox with me, maybe you get like 5 of those. It's addicting, it interacts with alcohol. That one is high risk, and it's only if things are desperate. I wouldn't recommend using it. There's other things we could do. There's something called Seroquel, quetiapine. 50 milligrams to 100 milligrams. You could give it every 4 hours. No matter how agitated, anxious you become, it will block the body's agitation and help you sleep. I try and just give it at night to get them to sleep. But if they're desperate, I'll just put them down. I'll say, here, take 50 to 100 milligrams every 4 hours and just let's get a calming effect of this drug. It's in an antipsychotic class, but you can use it. And it's usually an art form to mix and match all these drugs, giving something every 2 hours just to get people through this 5-day period. Now, I've seen it. It's ugly, but people get psychotic, confused, very disorganized. And I have to use Resperal, 1 to 2 milligrams every, say, 8 to 12 hours. So people get psychotic, start taking their clothes off. They pull the sheets off the bed, they get in the fetal position and start talking gibberish and confused and disorganized and making no sense. So I've had to use that. That is not that common, say 10% of people. Usually that occurs with high-dose methadone, when people are coming off methadone. But I've seen it with high-dose Oxycontin, hydromorphone, and I've seen people kicking heroin or coming off heroin. So those are just some ancillary drugs that can be used in conjunction with buprenorphine. And key here, stay hydrated. It's the difference between night and day. So I would say my first thing is stay hydrated. Because remember, if you're in opiate withdrawal, you're going to vomit and have diarrhea. So things get real ugly. So if you can't keep fluids down and electrolytes, you're in the hospital. So stay hydrated. And you have to fight constipation. Cheese, red meat, bread, those are good things to eat. Apples, rice, chicken soup. And I try and, before people get nauseous, I have them load up on those foods, and I have them be in a good, their hydration status to be very good. I mean, that's like drinking a gallon a day. Also, with this combination, stay out of the sun, stay rested, don't be driving, stay on a couch, and it's good to have someone around to help you get through this. That's what I tell people in my office. I go into this in depth in my book, Tales from the Couch, on Amazon.com. Just put in Mark Agresti. It comes up on Amazon. But I'll put a link on here. Tommy, one of my patients, recommended it from my previous video. You can find this on my YouTube channel. Thank you, Dr. Mark Agresti.